did you learn slight rotation? If you didn't, I don't want to confuse you. Knee's a hinge. Even though it allows slight rotation, it's basically hinge joint. Knee is basically hinge joint. And so that's the three big ones. The head of femur for the very large hip joint, the huge condyles of the femur for the comparably large knee joint. So head for hip, the two condyles for knee, and then the fourth articular feature is more subtle, but patellar surface. The patellar surface for the patella. And here's my question, I've seen it many times. The patellofemoral joint is what type of synovial joint? The patellofemoral, A hinge, B ellipsoidal, C gliding, D saddle. What type of joint? Good, yeah. Even though it's in the knee complex, the knee overall is a hinge, but if you isolate, everyone agrees, if you isolate patella on patella surface, you can see it's a gliding synovial. So you kind of, it's abstract because they always work together, but if you get the question patellofemoral, it's gliding synovial. Patella to patella surface of femur. Okay, and everything else on the femur is muscle attachment. There's a lot of features. The rest of them are muscle attachment, so I'll give typical questions involving some of these features. Which of the following features are located on the posterior shaft of the femur? Which of these are located on the posterior shaft? A, linea aspera, B, popliteal surface, C, gluteal tuberosity, D, lateral supracondylar line, E, all of them, F, some type of combo. Yeah, all of them, because this would be linea aspera, this here, and then you have lateral supracondylar, medial supracondylar lines, between them popliteal surface, still considered shaft that overlaps, but, so linea aspera, then it divides into lateral supracondylar line, medial supracondylar line, all this posterior shaft, popliteal surface, and gluteal tuberosity is this elevated roughened surface. It's for the, don't worry about it if you can't find it, but it's definitely posterior shaft for muscle attachment. Gluteus maximus attaches there. We're not going to ask that, but gluteal tuberosity is posterior shaft. So that's one potential question. The other one would be, oh, just know epicondyles are related to the condyles, their muscle attachment, their distal epiphysis. So the medial and lateral epicondyles of femur are muscle attachment, as is the adductor tubercle, this last bump on the before the bone kind of caves in, this last bump, adductor tubercle. We don't usually ask that, palpation landmark. So here's the other question. Which of these features of the femur are located proximal epiphysis? Which of these features, I'll make it straightforward, which of these features are located on the proximal epiphysis? A, neck, B, fovea, C, lesser trochanter, D, intertrochanteric ridge, E, all of them, and then some type of combo. So it would be, I could have said head, I didn't say head, I said neck. I think I said fovea, which I'm gonna do in a second, more detail. Any of the, like, trochanters are just large, bigger tuberosity, same as tuberosity, muscle attachment. So the progression is tubercle, smaller bump, tuberosity, larger surface for major muscle, trochanter, especially the greater trochanter, giant tuberosity, and then the intertrochanteric ridge, or actually intertrochanteric crest, all of that's proximal epiphysis. So the head, neck, the pit, and the two trochanters, intertrochanteric crests, are all proximal epiphysis. And before I forget, because I sometimes do forget, so I'll try to draw this from I'll draw it from an anterior point of view. This is kind of os coxa. This is acetabulum. so this just femur, and this is fovea on the head of the femur. This is head. Fovea means pit in Greek, and then I'll use the same color. So the fovea is actually for attachment of a. There's very few intercapsular ligaments in the skeleton or in the body. Only in the knee, where they're called ACL, anterior cruciate, posterior cruciate. I'll get to that later. And it's not really on the test, or just be aware of the name, that they're intracapsular. And the hip has one, because this would be the capsule. This would be the large capsule of the hip joint, and this is deep inside the capsule, can never palpate it. So what I drew here kind of has a roundish shape. Usually the ligaments are just a cord shape. This is a roundish shape. So it's called two names. Generically, it's the intracapsular ligament of the hip joint. Intercapsular ligament of the hip joint.
Intra or inter?
Or,
Intra.
oh, intra, I-N-T. Intra means inside. I'll come back to that, but intra means totally inside, like intracellular fluid or cytoplasm. So intra means totally inside, in this case inside the joint. But the technical old-fashioned name is ligamentum teres. Even though that's very picky, know that. That the intracapsular ligament of the hip joint between the acetabulum and the fovea of the head is called ligamentum, very old-fashioned, like ligamentum nuchae, nuchal ligament. I'll do that in a little bit. Ligamentum teres. They were very impressed with the roundish shape. It flares out. Usually ligaments are just like a cord, like a tendon, but this one flared out, and it's almost round. Teres means round. You don't need to know that. That'll come up when we do the muscles in myology in a couple of 2 or 3 weeks. Teres major, teres minor are shoulder joint, shoulder area muscles that also based on a round shape somewhere. But just know this name, that the intracapsular ligament of the hip joint is the name. It's a very. Did you have this name in the course? Everyone had it, right?
Yes.
So ligamentum teres is the name of the intracapsular ligament of the hip joint. And I'll come back to what's intracapsular, what's extracapsular in a joint in general when we get there in a little bit. Okay, so that's the fovea for the intracapsular ligament, and there are no extracapsular ligaments of the hip joint. You either have, this is the capsule, and if the capsule is thickened anywhere, that would be a capsular ligament. So if it's just a thickening of the capsule, that's more on the outside, it would be called capsular, which probably won't be on the test, but that's capsular ligament. If it's just part of the capsule or thickening, it's capsular. And then there's one ligament deep inside. That's the ligamentum teres. So when it's deep inside the joint capsule, they're rare. The only 3 that are there might be another one somewhere, but the only 3 in the body that are well known are, 2 are well known because they're injured sometimes. Anterior cruciate ligament of the knee and posterior cruciate, and I'll do those later in the review. Those are intracapsular. And then the third intracapsular ligament, it's not as well known for a positive reason. It almost never gets injured. It almost never gets injured. If it was injured a lot, we'd be more well known, so it's good. If you're not well known, it's better to, but for us, but it's called ligamentum teres. Okay, and so the other features, actually I did all the features of the femur basically. Like the 3 articulars, And just know what's proximal epiphysis, what's shaft. There are no features on the anterior shaft. So it's on the shaft because the posterior shaft is roughened with distinct features. The anterior shaft is like the parietal bone. It's not a flat bone, but it's a smooth, flat surface, and there's one giant muscle. It's a deep quad that attaches there, but that's way down the road. We're never asking that. But there's no features because it's just a smooth, flat surface. So it just doesn't have a name, and except the anterior shaft, we don't ask it. But there's a lot of features on the posterior shaft, and then there's a lot of features, just beware names on the proximal epiphysis. Distal epiphysis, the popliteal surface we're not going to ask because it overlaps the shaft and the distal epiphysis. But this is a notch, intercondylar notch. Don't worry about function. This is patella surface, and then the giant two condyles. Those three are articular. The two condyles are very articular for the knee, patella surface for patellofemoral, but epicondyles are never articular. Epicondyles never articular. And intercondylar notch is no function, just know it's distal epiphysis. Okay, so we go to patella. And now the patella, there are 4 facts that you need to know. I've seen this in a question. Number 1, it's a sesamoid bone. There are other sesamoid bones, but they're not on the test. They don't have names. They just have locational names, and they're not on the test. So in the 206 total, the only one called a sesamoid bone categorized is the 2 patellas. So that's number 1. They develop and are still housed within a tendon. So it develops within the quad tendon. Don't worry about that name. And in adults, still in our body, still housed there. And so protects the knee joint anteriorly. It does protect. So sesamoid bone protects. It's better to have a bruise of the patella than injure the deep stuff, the ligaments and the menisci. So protects the knee joint. And articulates with femur to form patellofemoral, which is gliding. But it's attached to the tibia, but this is not articulation, does not articulate with tibia. Everyone agrees. It attaches, but there's no articular surface on the tibia or patella for each other. So you can actually see it better here. So it definitely slides into the patella surface, but it has no congruent surface. It's attached by like a ligament. This is like represents a ligament, but there's no, or does not articulate with tibia. So articulates with femur, but does not articulate with tibia. So those are the 4 facts. Sesamoid bone protects knee joint, articulates with femur, does not articulate with tibia. Okay, now I'll do tibia. And tibia has a lot of articular features, and everything else is muscle attachment. So the tibia has a lot of articular features. One of them is, from our point of view, controversial, so it won't be on the test. One of them I wouldn't worry about test-wise whether it's articular or not. But the 2 that are clearly articular, the other thing about the tibia, because the articular part of the 2 condyles are concave, slightly concave for these giant femoral condyles, if you just named them condyle and had epicondyle, it would be a contradiction because the condyle's got to be convex. So instead, what they did was, and it makes our job easier, there are no epicondyles on the tibia. There are epicondyles on the distal femur and on the distal humerus. Those are, and there might be some others somewhere, but those are the only ones we need to know. So this entire surface of the tibia, including the articular part, is called condyle. So you have medial condyle. All of this is medial condyle. And all of this giant surface is lateral condyle. So basically, even though there's just one part of it is for articulation, we just say medial condyle of tibia, I've been saying it anyway, articulates with medial condyle of femur, that's about half of the knee joint. So medial condyle of tibia is all of this, but there's an articular surface for the medial condyle of the femur, that's part of the knee joint. And then lateral condyle of tibia, this is the lateral condyle. but all of it's lateral condyle, but there's an articular surface. We still say lateral condyle of tibia to lateral condyle of femur. That would be the other part of the knee joint. So you have medial condyle tibia, lateral condyle tibia, they match the condyles of the femur for the knee joint. And then, just be aware, just like the head of the radius is not exactly analogous, but the head of the radius has two articulations, so does the lateral condyle of the tibia. The main one is the knee joint with the femur. The main articulation of the lateral condyle is with lateral condyle of femur, but on the side, on the lateral aspect, the lateral condyle of the tibia also articulates with the head of the fibula, and that's named, like the radial ulnar joints, proximal tibiofibular joint. So that's between the proximal tibiofibular joint is between the lateral condyle of the tibia and the head of the fibula. And the head of the fibula, and that's called proximal tibiofibular joint. And that's gliding synovial. That's a little tricky, but we usually don't ask that, but that's gliding synovial. Lateral condyle tibia, the head of fibula is gliding synovial. Okay, then we go distal. Technically, this inner ankle bone is articular with part of the talus, but we're not going to ask that because some teachers teach it, some don't. But just know this giant bump that looks like a knob on your medial ankle is called, the real name, it's really tibia, medial malleolus of the tibia. That giant knob is the medial malleolus, very palpable, visible, medial malleolus of tibia. Then, again, we don't have a standard name. I call it distal concave articular surface, but they might just say distal articular surface. This surface forms most of the ankle joint. This distal tibial surface articulates with the talus or tarsal 1 to form a lot of the ankle joint, which is hinge. So this is definitely a articular surface. This surface here, definitely distal tibia, distal concave articular surface, is articular with the talus. And so that's 4 articular features. 2 condyles, one of them has 2 articulations, but we're not going to ask numbers on this, it gets confusing, but these are, the condyles are articulate, makes 2. I count the medial malleolus, but if you don't worry about it. So this is definitely articular, this distal concave articular surface for the ankle. And what's the trickiest articular feature of the tibia that I didn't mention yet is and I better get a tibia. It's actually fibula notch. It's like radial ulnar notches of the tibia. It's named after the other bone.